Hey guys, Dr. Pelto here. I want to just do this little slideshow that was sent to me by Biomedics. Basically, Biomedics is they do testing for circulation. And April, if you don't know, is Limb Loss and Limb Difference Awareness Month. And we see a lot of patients that either have amputations or we're trying to avoid amputations. So I want to go over a few of the stats they sent me here. The first stat is that 500 or more people lose their limb in the US every day. These are stats that are kind of staggering. They're kind of make people scared a little bit, but the whole goal is for us to realize how we can prevent them. And there are some resources on this site. There's a little booklet on, if you go to drpelto.com, the booklet on how to diabetes, just a general book, and also one on healing foot wounds. 65% of those that underwent amputation were not assessed for PAD or peripheral arterial disease. That's basically testing how the circulation is in your legs. The way I kind of explain it to patients is if you have like PAD or arterial disease in general in your heart, that can lead to a heart attack. Okay, if you have it in your neck, it can lead to a stroke. If you have it in your legs, it leads to peripheral arterial disease, which is sometimes and very commonly not diagnosed. I tend to test people that have diabetes over the age of 50 or those that don't have diabetes over the age of 70, kind of independent of symptoms to verify so we're not missing something. This is an example of the test that we do in the office, a little outdated photo, but we basically put these these cuffs around the ankle, above the ankle, below the knee, and above the knee. It's done in the office. It doesn't take that long. There's different methods that are even quicker and quicker, and it's something that's covered by insurance. So it's something that if you have diabetes, you should have this done. 60 to 80% of non-traumatic amputations are performed in diabetics. What I mean by non-traumatic, that means, like, let's say you get your hand stuck in a machine at work. That's a traumatic amputation. Non-traumatic amputations are normally caused by a sore or an infection or a wound or something like that. And I want to give you an example. This is a patient of mine, and she had a little infection. Basically, she had a callus from the rubbing of the two toes together. You can see this. It's a little bit red, a little bit swollen, and she had diabetes. And we were planning on removing a little of the bone. We didn't do it quick enough. She was on antibiotics, but it led to a bone infection and led to an amputation. So something as simple as a little callus between the toes can easily lead to an amputation. The challenge with an amputation is that the death rate or mortality rate after an amputation in a year is about 48%, in about 3 years is 71%, because it's kind of like the tip of the iceberg. These patients, they have poor circulation, but they have other issues that are going on. Usually it's not the amputation that takes their life, unless there's like an infection or something, but it can lead to other problems. There's a cost issue as well. It's very expensive for people that have amputations, and it's just millions of dollars. Lower extremity amputation increases the chance of future amputations by the same person 200-fold. So if you ask, what's the greatest risk of having an amputation, is having a previous one, okay? Greatest risk of getting an amputation the first time around is an ulcer. Usually it's along with diabetic. Example, this patient here, you can see if you count the piggies, there's 1, 2, 3, 4, the fifth one's missing. This patient did have an amputation due to an ulcer. And what happens, that changed the way their function is. That changed the way their toes work. The toes have to work more. Here's an example you can see here, the same patient missing that, but look at what happened here. So this very easily could lead to an amputation. This did not in this case, but it very easily could lead to an amputation. What are things that you can do if you have diabetes? Exercising, quitting smoking, healthy eating, seeing a podiatrist, I think, should be on here as well. The best thing is if you've had an amputation, you do be seeing someone every 2 to 3 months. Once again, exercise, they're talking about that is due to PAD, peripheral arterial disease, that can help blood flow, but be careful you have the right shoes on, because a lot of times shoes can cause a blister or a sore. Quitting smoking, it's obvious. Eating healthy, that's kind of a talk for another day. Don't eat cake, but once again, the most important thing is seeing someone for this. And then also preventing it, inspecting your feet, moisturizing your feet. Once again, if you're a diabetic, every diabetic should see a podiatrist at least once a year. If you have other problems like poor blood flow, poor circulation, you should see him more frequently. If you had an amputation, basically every 3 months. It's important to talk to your doctor if you have pain in your legs. These are claudication symptoms. Basically, if you have pain after you walk a certain period of time and it gets better when you sit down, that's a claudication. You should see someone, or a slow healing wound. Of course, you should be seen by someone. This is provided by Biomedics. I hope you guys found this beneficial. Here's some sources that they referenced. If you want more information, what I would recommend is going to my site, drpelto.com, and there's 2 books I'd like you to download. One is on just a healthy living guide to diabetes, what you should do, and another book is on healing your foot wound fast. Now, this doesn't replace medical care; it's just some information for you. So, hope you found this beneficial. Once again, we'll see you soon in the office. Thanks.